Hey everybody, Ziv Simon here. I'm the creator of Surgical Master. Welcome to this video. And in this one, I'm going to talk about how to write your surgical notes. And this is coming from a doctor actually in Calabasas, where I live, Dr. Arman, that sent me a very nice email and basically wanted to know, hey, how do you write your surgical notes? You know, I do this all the time, but just I'm curious how you do it. So, first of all, writing notes in general in a medical record is a super important thing for many, many reasons. And first of all, you'd like to document exactly what you do, what you discuss with the patient has a medical legal significance. It allows you to go back in time and assess what you did, understand, as long as you can read your handwriting, understand what you did, and make some draw some conclusions about how the treatment is going, and even make some decisions about future treatment. So record keeping is very, very important, yet it can be time consuming. Some of us write too little or too much, or not sure you're writing the right thing. So I wanted to give you just a sample of, let's say, just notes about an extraction and a bone graft of a lower molar, a money-tooth. And just to give you an idea, and I'm happy to create more of these videos about writing notes for different types of procedures. And of course, this is just a sample. It does not mean that that's exactly what you need to write, and it doesn't mean that what I'm writing pertains to your patients and cases. So just a little precaution here. And it's also possible that every different state and country in the world has different rules and regulations on how to write notes. So please refer to your local dental organization that basically sets the rules. So here it goes. When we talk about an extraction and a bone graft, the first thing that I'd like for you to consider is the chart cannot start just with the treatment. There should be some separate appointment, in my opinion, that has all your consultation notes where you diagnose the need for the extraction or the procedure, where you reviewed the procedure with the patient, where you explained why this tooth needs to be extracted, what is the course of action, maybe the treatment sequence, and that you discussed different options and alternatives with the patient. And in case you're seeing the patient for the first time and also for some type of emergency treatment, it's still important to write down what you consulted the patient about and what was your conclusion or recommendation. And then another section is the actual treatment. So keep them separate. And obviously starting with the date of treatment and the procedure that was done. For example, extraction of tooth number 30 and a bone graft as a title. And then explaining, in short, why is this tooth extracted? That's extremely, extremely important. So there's a record that there is a reason behind your recommendation. For example, the tooth has a hopeless prognosis due to a root fracture, or it's non-restorable because of caries and things like that. Don't just write the treatment. There has to be an explanation. Even if it's obvious from a radiograph and it's obvious that you discussed it with the patient, there still has to be a valid reason for your treatment and a diagnosis. That's extremely important. We're not just treating patients, we are working by a proper diagnosis and a treatment plan. So based on the diagnosis, you also very briefly say what you recommended. Very briefly, like an extraction, bone grafting, delayed implant replacement. Put it down so it shows that you are not just performing a treatment, but also have a logical and acceptable course of action. You have to document that a consent was signed, and in the case the patient needed to be pre-medicated for medical reasons or because of anxiety, write down what they were pre-medicated with, let's say a sedative or antibiotics. Write down in detail what type of local anesthesia. Some doctors actually put down the topical anesthesia and what type, and I think that's okay too. Nothing wrong with that. I don't personally. I write down the local anesthesia, the exact anesthetic that I've used, and the number of carpules, and what type of method of anesthesia I used, whether it was an inferior velar block and infiltration, just in short. Then I would describe in brief the type of incision outline that I made, for example, an intracellular incision and the extent of it between which teeth, and a full thickness flap on the buccal and the lingual, just as an example to describe what was the surgical approach. And then in brief, I write down it was a surgical extraction, meaning I split the tooth. I needed to use a handpiece. It's not just a regular extraction. And once the tooth came out, I debrided the socket and I grafted with your choice of bone graft material and other materials that you may have used, like collagen or membrane. Just in brief, you don't have to describe the exact detail how you trimmed the membrane and you did an awesome job. Okay, just give the clean details. Now, if you use some type of biomaterial of any type that comes with a sticker, put the sticker in the chart, ideally next to the treatment description. And the sticker will have all the important information about the material you used, the serial, the reference number. And in case there's any type of problem in the future, like a recall, you can always go back and you can track what material you used and what batch it came from. So that's very important. Once you're done with the grafting process, I write down what type of suture I used, the material and the size. And I also write what type of suturing technique, like an X suture or an interrupted suture. I write down that hemostasis was achieved, that I was able to control the bleeding. And that's basically the end of the surgery. So it's a very short description, very dry, but gives all the important details. Now, of course, if you had any type of complications, problems, challenges, you did more things, of course, you need to write them down. Now, at the end of the procedure, I write down that I gave post-operative instructions, and I write down that I gave them in verbal form, but also in writing. So I encourage you to have a written post-op instruction form that you will custom make for the patient based on the procedure you just performed. And it should ideally have all the general post-operative instructions. It should have some room for what type of medications to take. You should have your contact information and spend enough time to review this with your patient. You'll see that your results will be better once your patients follow your instructions. In the chart, I also write down what type of medication was prescribed and how to take it in regards to antibiotics, pain medications. And if you're prescribing a narcotic, write down how many pills you prescribed and how to take it as well, how to combine medication if indicated in very brief. Now, I write down that the patient was scheduled for a 1-week follow-up if that's the case. And if the patient was sedated, make sure that you document that they didn't just leave the office by themselves and were struck by a car. If they're sedated, they need to be escorted by a responsible party, like a spouse or a boyfriend or a parent, and that can bring them to their home safely, because again, they're not responsible. They cannot drive being under the influence. So that's pretty much it. Very brief notes for an extraction of a lower molar and a bone graft. If you have any comments about that, let me know. But for me, that sums it up, and that's 99% of what I do. And of course, at the end of your notes, you give your signature, your autograph. And I would like to see in your charts, at the same date, I'd like to see some type of note, and you can write it actually the next day, where you called the patient the same night and inquired on how they're feeling, answered some more questions, made sure they're doing okay. That's a great practice builder, but also very important from a medical legal point of view, that a procedure was done, the patient is doing well, you followed through, you're a caring doctor, and your patients will appreciate that. So I hope this brief video on how to write surgical notes was helpful to you. I know this is important. I know sometimes we don't have the time, we rush through it, and our handwriting is not as legible, but it's very, very important from a medical legal point of view for you as the surgeon to understand and be able to read your previous notes, to know what has occurred even years later, and be able to draw some conclusions from previous treatments for this particular patient and other patients, and grow as a surgeon. I would really appreciate if you leave me a comment below. Let me know how you write your surgical notes. Give me some feedback. Feel free to share this video with other doctors, and sign up on my website, surgicalmaster.com, for my weekly blog and email newsletter and video. And I'll see you at the next one.